Hey, I'm sitting with Dr. Wood and we're talking about pain relief options that mothers, expectant mothers, can have when it's time to have a baby.
Well, it's a really important subject. There are so many options available, but let's just go through a list.
Okay.
Right? I guess the first thing to understand is that we've got to think about mum and baby.
Right.
You know, there's two people here that are going to be affected by some of your pain relief options.
Right.
In the ideal, perfect world, it would be good to have no pain relief.
Yeah. And some women do.
And a lot of women do.
You. Yeah.
And it's great.
Yeah.
But that isn't appropriate for all people. And sometimes, like if you're having a twin delivery or certain other procedures, it seems very appropriate to have some pain relief.
Right.
So,
because you could get to a stage where you need some medical intervention.
That's right. And especially with twin deliveries as such, you know, it's
Speaking of experience.
Yes. It's likely you need to have some intervention that if you didn't have pain relief might prevent you from being
And it doesn't make you any strong of a woman or less
The goal is to have a baby.
That's right.
It's not about how you get there. It's about the result at the end.
I think that's so important that we remind our mums that.
Correct. And, you know, just because one person had a caesarean section or one person had a vaginal birth, it doesn't make no, you're all important mums and you're doing a great thing. So, during labour, what options are available for pain relief? We'll start with a lesser option and work your way up. It's really good to think about things like getting in the shower.
Right.
Something with warm water on the back can really helpful.
Okay.
Someone's going for a walk and actually walking.
I did that.
And going for a walk when the contraction's there, not just stopping, but walking while the contraction is actually really helpful.
I was dancing in the labour room. So
there's nothing wrong with that.
Moving.
Sometimes having some cranking music in there is really good too. I had one person who had Metallica on in their room. It was like pretty cool.
Okay, so let's get to the good stuff. The meds.
Okay, so you can have nitrous gas and it can be dialed up to different degrees. Now, I don't recommend starting out on 100% because it really makes you sick straight away.
Right.
Start out really low dose and you've got to take 3 or 4 big breaths in before you start noticing an effect. A lot of people use that. It's very effective. And
is that the gas?
The gas,
I love the gas. Sorry.
Yeah, nitrous. Right. So the next...
It helped.
It does. It can help. And it kind of distracts you and takes you somewhere else.
Yes.
And you tend to use it just when the contraction's there and then you stop it when it's not there. You can have an injection of a narcotic like pethidine or morphine.
Right.
Now, so the gas, once you stop it, it's out of your system pretty quick.
Okay.
When you have morphine or pethidine, it lasts for about 3 or 4 hours.
Right.
And if you're imminently about to deliver your baby, it's probably not a good idea because that can affect your baby.
Yes.
And can make the baby a little bit sleepy. And then but if that happens, say for instance you have this injection and miraculously you've delivered the baby shortly afterwards, there is medicine they can give the baby to reverse the effects of that injection should that be needed.
Right.
Very uncommon that that's the case, but again, and morphine, what does it do? It's a sedative, it's a relaxant, it's a pain reliever, and it can have all the effects. Negative side effects of morphine can make you vomit.
Right.
So sometimes when they give you the morphine, they may give you medication to...
Okay. Then you have the epidural, is that right?
Epidural is the next sort of and final place to go to.
Okay.
Right? And epidurals are brilliant.
Right.
They allow you... They basically kind of semi-anaesthetise your body so that you can have contractions but not actually feel the discomfort. You may still feel some pressure.
Right.
And they can be turned up and down. An epidural is basically a little tube that's inserted next to your spinal cord and medicine is infused in there very slowly, which basically numbs those nerves.
And I think it's important to have these discussions with your doctor.
Beforehand.
So talk about the different options that you have when you're having the baby prior to being in that room. And I think that's the way
occasionally, as a general rule, the midwives and the support people in your birthing unit, they don't tend to offer you pain relief for a reason because you might be managing very well.
Yeah.
But if someone, you know, then says to you, look, you're looking great, but we'd be interested in having an injection of some pain relief, you know, it might get you to a moment of weakness and you weren't hoping to do that. So generally what happens is they wait for you, the patient, to ask.
Yeah. And I think it's so important what you said at the beginning, which is at the end of the day, it's about bringing on a healthy baby and you being a healthy mama. So keep it locked right here for great tips like this and so much more.